Thank you for joining today for our daily COVID-19 briefing. Our effort here to give as much information as possible and to give as much guidance to Tennesseans as we all work together to mitigate the effects of COVID-19 here in Tennessee. Our current case count for the day is 2,845 cases. We have lost 32 Tennesseans to COVID-19, and we have performed 34,611 total tests. Earlier this week, I signed a Safer at Home executive order urging Tennesseans who are not in essential capacities to remain at home unless absolutely necessary. We also closed businesses that can't possibly operate safely. We believe the intent of this order is clear. We need all Tennesseans who can to stay at home. That said, over the last 2 or 3 days, we've seen some troubling data points that tell us that some in our state may not be staying in place as much as we would hope. While many Tennesseans have made good faith efforts to remain at home, there's clear evidence that some citizens are beginning to disregard safer at home measures. It's dangerous, it's unacceptable, and it's a threat to lives in our community. For that reason, today I want to step further with my Safer at Home executive order and have said that Tennesseans must remain at home unless they're engaging in essential activity. Data from the Tennessee Department of Transportation analyzed traffic patterns for March 2020. While Safer at Home measures and further restrictions on businesses showed a steep drop-off in vehicle movement from March 13th through the 29th, data beginning on March 30th indicates that travel is trending upwards again. We've also looked at data from a company called Unicast, which anonymously tracks cell phone mobility to determine movement trends among people. Unicast indicates the movement of Tennesseans is trending back toward pre-COVID-19 levels after initially dropping. In addition to updating Executive Order 22 to require staying at home, I provided guidance in a guidance letter to local law enforcement with respect to enforcing previous Executive Orders 17 and 21. According to that guidance, businesses will be given an opportunity to comply with the orders before further enforcement action will be taken. We're asking businesses to act responsibly and not put public health at risk, and we expect that they'll do that. I want to take a moment to speak directly to every Tennessean. April stands to be a very tough month for our state. COVID-19 is an imminent threat, and we need you to understand that staying home isn't an option. It's a requirement for the swift defeat of COVID-19 in Tennessee. I also remind Tennesseans, please refrain from panicking when you buy or hoarding groceries and other essentials. Our supply chain is strong, and you should remain with your normal shopping habits when you go out to do your essential purchasing. Now I want to talk a little bit about surge capacity. During my briefing yesterday, I discussed the need to use every tool in our toolbox as we prepare for the potential surge in COVID-19 cases. Today, FEMA approved our COVID-19 major disaster declaration. This accelerates our efforts to work with the U.S. Army Corps of Engineers and expands our statewide capacity by an additional 7,000 beds. The Corps of Engineers is working for FEMA and in partnership with our state in responding to this crisis. Through our partnership with the Corps of Engineers, we're assessing sites across Tennessee to build capacity and create alternative healthcare facilities. Using the Corps' engineering expertise, planning and design processes, construction capabilities, team members in the Nashville district are taking on the mission of building out the assigned facilities. The Music City Center in downtown Nashville will be transformed into a COVID-positive, non-acute alternative healthcare facility. It will serve COVID patients who need hospital care but do not require critical care. The current plan for the Music City Center is to provide more than 1,600 patient care spaces. This facility would care for only COVID-positive patients transferring from area hospitals. We're quickly deploying on efforts to meet this demand. Some major alterations are necessary to accomplish this, adjusting the building's HVAC system to put exhibit halls under negative pressure, running piping for oxygen gas, modifying utility connections, and constructing temporary modular partitions for patients. It's not just about finding capacity for this, it's about building out support services, furniture, supplies, staff, to ensure that these extra capabilities will deliver the utmost quality care in the midst of a potential surge. In Memphis, the Corps will be constructing a COVID-positive, non-acute alternative healthcare facility as well. We've identified Gateway Shopping Center as the location, and our team is actively assessing additional sites in Memphis to ensure capacity in this hotspot is built up quickly and efficiently. We've selected sites in Chattanooga and Knoxville as well. These sites will be in the Chattanooga Convention Center and the Knoxville Expo Center. I'll be meeting with leaders in Knoxville and Chattanooga tomorrow to discuss these efforts. While facilities are a key part of planning for a surge in COVID-19 patients, we must have staff available to care for these patients. We're calling on all displaced or furloughed healthcare personnel in our state and beyond to register on the Tennessee Department of Health website, to work together with us to address the challenges that we have ahead. I want to ask Major General Holmes to provide further detail on the build-out efforts for additional capacity. We'll also have Dr. Piercy give a health update before we answer questions. Members of our Unified Command Team are here as well. And as well, Sonny Avachal, who's the commander of the Nashville District of Army Corps of Engineers, is here to answer technical questions about the build-out as well. General Holmes.
Thank you, Governor. So just a quick update on our guardsmen and airmen that are out there currently. We've exceeded now 400 personnel that are spread out all across the state. That number continues to grow. The governor has authorized us to call up to continue to alert and mobilize and deploy our soldiers as the needs arise. Frankly, we're ahead of that need. We're always going to be ahead of that need, and we looked at some missions. We've actually executed a number of surge missions over the past 4 days, so we have the data to know what our capabilities are. We also have a field treatment unit that's on standby in Smyrna, so we're always anticipating the next big need. To talk briefly about the Corps of Engineers effort, 2 weeks ago we received a capabilities briefing about this new program that was being developed in New York. Obviously, it's a very complicated program, but it was an initiative to create bed space out of alternative facilities such as large open arenas, stadiums, and things of that nature. The governor directed us to engage the Corps immediately. At the time, obviously, we were somewhat far away from the need, but we could see the need arising based on what the other states were experiencing. So we immediately engaged the Corps. I think those 2 weeks were absolutely critical because it put us in an assessment mode. As TEMA requested the assessment phase through FEMA, it let us get in line, so we weren't behind a number of other states. That allowed us to do these quick assessments, and I say quick, the Corps has been actively looking at a multitude of spaces, and they can turn assessments around in 12 and 24 hours. And obviously the complicated part of that is assessing the appropriateness of the facility to include HVAC, negative pressure, suitability, flexibility, all those things kind of come into play. I would like to also talk that there's a number of steps that have to happen. The governor mentioned the emergency declaration that had to happen. The request that goes from TEMA to FEMA to authorize this has to happen. Normally that would be a sequential process, but that takes time, and we knew this was not a normal situation. So all these steps happen concurrently and simultaneously, and that has allowed us to arrive at this point in time where we can enter the second phase of this, which is the build-out of the Music City Center. So I'll be available for comments, and Lieutenant Colonel Avachal is here as well if we have questions further. Thank you, sir.
Mm-hmm. Thank you, Governor. Thank you, General. Your numbers for today, 2,845 cases with 263 hospitalizations and 32 deaths. We have done 34,611 tests and have remaining 35% of our inpatient beds, 34% of our ICU beds, and 71% of our ventilator capacity is available. I do want to highlight that our number of recovered patients is growing, and our number of recovered patients is now at least 220. Something that I want to brag about is our testing, and we continue to test much higher than other states, but we're about to take that even a step further. As of yesterday, at least 2 labs in the state were able to provide the 45-minute test, and that capacity will continue to grow. It's going to start out small, but by the first or middle of next week, that capacity will likely exceed 1,000 tests per day per lab, as long as the supply chain continues. Finally, I want to draw your attention to one thing to make sure you remember. As the governor has mentioned, April will be a very serious month. We need all Tennesseans to put forth their best, most serious effort for the entire month. I also want to bring your attention to something that you should be warned about. You might notice that today's number, a little over 2,800, is less than 200 above yesterday's. That rate of rise did slow, but that is not a trend. That's what we call statistical noise. What that likely represents is a lot of private labs have a 4 to 5 day testing lag, and 4 to 5 days ago was the weekend. We know people present for care less often on the weekends, and so I want to encourage you not to interpret that that these numbers are going down or they're slowing down. This is just what we consider normal statistical variation, and it is not yet a trend. Again, April will be a very serious month, so do your part and stay apart.
Thank you for that. That's the bulk of the comments at this point. It's the newest information that we haven't spoken of before, that we wanted to get out to Tennesseans so they would know exactly what we're doing and the efforts that we're making. Again, we urge Tennesseans to each engage. As I have said for weeks, individual responsibility will win this with us doing that together. We must work together. We must take this seriously. We must stay at home. We must work together, and that is a critically important message that I would have for every Tennessean. We have made an additional effort today to require that, and that's important in an effort to save lives right here in Tennessee. So we'll be happy to take people's questions and get more information out to you through those questions.
Thank you, Governor. First, we'll go with Kim Crucy from the Associated Press. Kim, your line is open.
Hi, Governor.
Hi, Kim.
I'm curious how you plan on enforcing this latest order, going from encouraging to requiring people to stay safer at home. How will this be enforced?
Yeah, we sent an enforcement letter out to law enforcement officials yesterday regarding enforcement of 17 and 21. So we did that as a result of monitoring enforcement necessity, and we'll do the same thing. We'll watch this over the weekend, over the days ahead, and we'll take appropriate steps necessary for enforcement as we see them.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Hi, Governor. Thanks for taking our questions.
Yep.
I'm curious if you talked yesterday about projecting when the peak will be. So when at this point do you see the peak need for resources being? I'm looking at a model in front of me right now. It suggests it's around April 19th. That would be about 17 days from now. Can you give Tennesseans a sense of when you're seeing that coming?
Well, there are a lot of models, as you know, and we're looking at a number of models. We have a new updated model that we anticipate today or tomorrow. We talked about the Washington State model that we're using. As you know, it's very difficult to know exactly when that surge is going to happen. I said yesterday, I believe that the date was somewhere around the 21st of April, but we don't know exactly when that surge will be. It has a lot to do with the effects of social distancing. We know it works. We know that the strengthening of this order may impact that surge. That's the hope, because if we can push that surge out even a few days, it allows us to have access to more equipment, to get more beds built out, to find more personal protective equipment for our healthcare workers. It's all in an effort to flatten that curve. We don't know exactly when that surge would be, but we believe it'll be somewhere potentially in the third week of April.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Hello, Governor. Thanks again, as the others have said, for taking our question. I have two parts, if I may. Are you thinking of cutting back on the businesses considered essential?
We haven't looked at that. We're looking at strengthening our social distancing efforts through this new executive order. So we're going to watch and monitor, just like always. We look at information. When information changes, then we change direction. But we haven't looked at changing that list. It's consistent with a lot of similar lists across the country, and it keeps essential activity happening in our state, but restricts the movement of people. So, but as I said, I've often said, Chris, you know, information changes quickly in our state. It changes quickly in this country. Nothing is ever off the table. We're always looking to take in additional information and make the right choices going forward. So we look at information every day, and we'll be looking.
And the second part, why are Tennesseans, why do you think Tennesseans are not taking stay-at-home seriously?
You know, I think it's hard. People stay at home for a period of time, and then maybe, you know, they stayed home for a couple weeks and they're not sick, and it's difficult to project or to know why people may or may not take something seriously. And let me just say, a lot of Tennesseans have taken this very seriously. I want to say this. I'm proud of the way so many Tennesseans have taken this seriously and stayed home and done what they were supposed to do. But again, I make decisions based on information as it's available. We don't always have all the information. But we clearly saw data in the last 2 or 3 days that changed the movement of Tennesseans, and that was very worrisome, and it was also very dangerous. And that's the reason we took this additional steps. Hard to know why that's happened. We just know that it has.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yeah, Governor, I appreciate your time. Considering you're making this order now and schools are already closed until the 24th, do you feel that schools can really be opened again by the end of the school year? And there have also been some concerns raised about the state going ahead and rolling out the ESA applications in the midst of this crisis. Can you address that?
Yeah. Yeah, the ESA application, it has progressed, but certainly it's not going to have the same amount of enrollment as it would have. No one is focused as much on what's going to happen next year as what's going to happen in the next few months. But that program is continuing, and I've said before that we have a date of the 24th for schools to be open. We're going to watch closely and make decisions based on what we see in this surge and what we think the situation is going to be going forward. We'll be making a decision there before too long.
Thank you.
Next, we'll go to Stephen Elliott with the Nashville Post. Oh, did he drop off? Sorry. Yeah, no, there he goes. Stephen with the Nashville Post, your line is open.
Hey, Governor, thank you. Can you hear me?
Yes, sir.
Thanks. So I guess first, I'm wondering when you first saw this traffic data, and then also I'm wondering if you could tell us a little bit more about this cell phone tracking that was mentioned, you know, what that entails, and did you guys seek that out, or was it brought to you, and anything else you can tell us?
You know, I mean, the traffic data is watched by others, but the data that, I mean, TDOT tracks traffic all the time. That's a part of something they continuously do. And we've been watching that traffic, but it turned up about 4 days ago, and maybe 5 days ago, it started to change and to rise. And so we watched that for a few days to see if it was in fact a trend. It looked to be a trend. We looked at the numbers again last night. I looked at the numbers again this morning, and there was clearly a rise in movement back to levels that we hadn't had for many days before. The cell phone traffic, there's a company that provides data around. It's anonymously provided, so not individual cell phone activity, but cell phone activity in general in regions. And so we saw the numbers of the movement of Tennesseans by their cell phone activity, the movement of those cell phones, and that data is a part of what weighed into this decision.
Thank you.
Yes, sir.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Hey, Governor, I just wanted to follow up on the cell phone data, or the traffic data, I'm sorry. It looks like it began trending upward on Monday, Tuesday, Wednesday. Why wait until Thursday today to issue this mandate now? Why not do it yesterday or Tuesday?
Yeah, you know, when you're watching data, it's just like the cases of COVID in our state. You can't look too closely at 1 or 2 days to develop a trend. Before you make a significant decision, you want to find out if something actually is a measurable trend or if it's just an anomaly in the information. So 1 or 2 days of traffic flow, in our view, wasn't enough to determine a trend, but when you start seeing 3 or 4 days, it looks like a trend for certain, and we don't have time to wait for a week of data. So we took what we thought to be an actual trend, 3 or 4 days of information, and made a decision based on that.
And then real quick follow, did your decision on this have anything to do with the encouragement from medical community, including Senator Bill Frist, to issue this mandate?
Yeah, you know, I've said all along I'm deeply grateful for the medical community and the role that they're playing, especially right now. Many of them are kind of putting their lives on the front lines in fighting this. Their opinions certainly do influence and are very important. I've actually consulted with experts in the medical field since this began. Speaking to folks from around the country. I spoke to doctors from Cleveland Clinic. I've spoken to people from around the country to try and determine the best time for the right decisions that we've made. So certainly input from the health community. Dr. Frist and I have been talking for weeks regularly about the approaches we're taking, the numbers we see, the direction that we should be taking. I absolutely put value in input from our healthcare community and from public health officials who I've consulted with as well. So yes, input from folks, including the medical community and especially the medical community, have played an important role in our calculations.
Next, we'll go to Nancy Amons with WSMV. Nancy, your line is open.
Yes, thank you for taking my call. Can you speak more, please, to the logistics of how you turn someplace like the Music City Center into a hospital for COVID-19? That's got to be a gigantic undertaking.
I'm going to ask Sonny Avachal, who's the commander of the Army Corps of Engineers here in this region, to answer that question. He can answer it more specifically than I can.
Thank you.
Good afternoon. So the building out of a facility like this, it really started actually a long time ago, a few weeks ago, in the planning process. Now, I will say that the state of Tennessee, FEMA, and all the partners here have been extraordinarily gracious, been collaborating this entire time to come up with designs that would be rapidly accessible and be able to be delivered in a short period of time. Really, when it comes down to the core model for how a project like this is delivered, it's a 4-phase process. First process, is we're well underway, is choosing the site as a whole. So before everything got started, we took out a group of individuals, all with different expertise, cited the facility, understood everybody's requirements. Second phase is the actual build, which the Corps of Engineers will build. This goes back to building a facility that is acceptable by our state healthcare professionals, understanding negative pressure, understanding the size requirements of each individual cube or patient space that will be there, understanding the equipment that's going to be there. Third phase is going to be the supply of these facilities, and then the fourth phase will actually be the staffing. So all of that goes into the design up front so that we're able to execute this project in a short period of time. Thank you.
Thank you.
Next, we'll go to Nick Barris with News Channel 5. Nick, your line is open.
All right, thank you. Hello, Governor.
Hey, Nick.
Just wanted a couple quick follows on the enforcement issue. I talked to several of the sheriffs and police chiefs that got your letter last night, and they kind of have a game plan, and I want to know if you're on the same page with them. They're saying if there are those who are violating the orders, they're going to start with a verbal warning, following that up if they don't listen with a letter, then after that a citation, and short of that, arresting them, all within a matter of days. I want to know if that's something that you're in line with them on.
We've actually given the authority to individual law enforcement agencies across the state to actually enforce this in their own way. We think that's the best way for it to be handled. Different communities are different enforcement. Different enforcement teams are available for different areas. So we gave them guidance on how we believe that this, and we gave them clear direction that enforcement was appropriate and that it's something that we expect to happen if companies don't ultimately comply. So they will develop their own enforcement specifics in each community, but they've been given the directive to enforce.
Next, we'll go to Ainsley Daniel with WJHL. Ainsley, your line is open.
Thank you, Governor, so much for taking our questions. I have a multi-part question for you. The first one is, what should people do if they see a business that is non-essential operating outside of your mandate? And is there a way for people to report that business?
Yeah, they should report that to their local law enforcement officials who have been given direction and who have the authority to contact that business and go through the appropriate steps to get them to comply. That's the way it should happen in local communities. If there's someone that's not complying with an order, then they need to contact their local law enforcement official.
And my next question to you is, what is your advice to employees at large manufacturing facilities that have hundreds of people working in close confines without safety measures or social distancing options?
Well, we certainly hope that that companies are creating environments for employees who are working in those essential businesses, and where there's an indication that the safety of those individuals is not available, then they need to contact local law enforcement as well. We want to work with companies. We want to make certain that we can keep essential businesses operating. We've seen a great deal of effort for companies to create safe environments for their employees. But if an employee feels like that they're not in a safe environment for whatever reason, they certainly ought to talk to their employer about that and then take appropriate steps otherwise.
Thank you.
Next, we'll go to Jonathan Mattice from the Associated Press. Jonathan, your line is open.
Hi, Governor. I wanted to ask you about the Gallatin nursing home again, just to get a quick update on people's conditions there. And also, the Sumner County mayor had told one of our reporters recently that once employees there became symptomatic, they should have been asked to go home immediately and called the health department. He said he did not think that occurred. I was wondering if you had any indication of something like that happening at that facility.
I'm going to let Dr. Piercy answer specifics around that. She's been very involved in that.
Thank you, Jonathan. So the Gallatin nursing home situation is starting to resolve. As of today, we have surveyed and inspected the facility. We've ensured that they have disinfected and decontaminated the facility based on CDC recommendations, and we are in the process of a controlled back transport of patients into that facility. At this time, all of the negative patients who are medically appropriate to go back in will be transferred, as well as those who meet the definition of recovered. We will not be putting any patients in active infection or who are an infectious risk back into the facility until they are completely clear of their infection. Related to contact tracing and how this situation unfolded, I did get a preliminary summary of the events this morning. Haven't yet been able to drill down into the detail of what the timing was of exposure, but as is coming out on a national level recently, particularly coming out of Singapore, there does appear to be a growing concern of pre-symptomatic spread, which means you can pass along the infection before you actually have symptoms. Anecdotally, this seems to be even more prevalent in the elderly, and so we're still awaiting to see what role that has to play.
Thank you.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
Thank you. Thank you all for being here. It's important that we continue to provide as much information as possible. It's also important that we say over and over again, and I won't stop reiterating over and over again. Certainly, it's more important today than ever that we have a very difficult situation ahead of us, but every one of us can do something about it. We can choose to separate. We can choose social distancing. We can choose to adhere to the guidelines and to the requirements. We can choose to protect our neighbors. We can choose to serve the elderly and to buy responsibly and to engage in what is a unified effort of Tennesseans to address COVID-19 in the best way possible that we can. We can each do our part to stay apart. Thank you very much.